Welcome to Laser Optech webinar. I'm Jimin from Laser Optech. Today we'll be presenting picosecond laser LIOP with subtitle More Than Pigmentations, a Paradigm Changer of Texture Resurfacing. There will be a question and answering session after the presentation, so please utilize the question tab if you have any questions during the presentation. PicoLO, which will be mentioned in today's webinar, is a picosecond Indiac laser system developed and manufactured by Laser Optech in South Korea. PicoLO is built on Laser Optech's long-term technological excellence and is renowned for its stable pulse duration and energy output. Our special guest speaker is Dr. Kwon. He is a dermatologist and clinician at Oaropibu과 Clinic in Seoul, South Korea.
Hello everyone, good evening. Niman hao, konbanwa. I'm Dr. Kwon from Korea. Today I'm going to talk about very interesting characteristic of PicoLaser. So let me start. As all of you may agree, PicoLaser is booming in dermatologic society. I think this graph tells you about 90% of what PicoLaser is. With shortened pulse duration, it has increased peak power. This characteristic of light actually generates mechanical wave leading to photoacoustic wave, and it breaks up the target. From the perspective of thermal relaxation time, this kind of laser pulse has advantage for the treatment of exogenous small tattoo particles. And from the perspective of stress relaxation time, this kind of laser has advantage for the treatment of endogenous melanin. I think all of you may have Q-switch NDR in your clinic. Nanolasers rely on photothermal action, delivering heat to the pigment and surrounding tissue. However, PicoLaser with this ultra-short pulse duration triggers photomechanical effect. Photomechanical effect is the mechanism by which the chromophores of lesions are fragmented and broken up following the application of short laser pulses that can quickly hit up the target chromophores. I have used PicoLO laser for the last 3 years and used very satisfactorily. Let me talk about it in detail in the later part of my presentation. And they provide 4 tips, and you can change tips depending on your indications. Today I'm going to talk about 3 subjects, but I'm going to briefly cover 2 topics, and let me focus on the third, LIOB treatment. And at this presentation, I will first release our collaborative clinical study for Pico versus Fraxel for acne scar treatment. As all of you may agree, Pico is very nice to treat tattoo. Even compared with Q-switch NDR, I definitely think Pico has advantage compared with Q-switch NDR. With this kind of color tattoo, you can treat easily with Pico lasers. So here is my opinion for tattoo treatment with Pico laser. Tattoo treatment is the optimal area for picosecond lasers, even compared with conventional nanosecond lasers. And combination of multi-wavelengths of Pico laser is useful when treating various colors of tattoo. And 532 nanometer is especially useful for red color. Post-treatment care is still needed even for Pico lasers, but side effect incidence were lower in Pico lasers. With deeper penetration and weakened selectivity of wavelengths for chromophores generally guarantees good result for Pico lasers. The second subject, I'm going to talk about the treatment of endogenous pigmentation with Pico laser. This patient concerned with nevus of Ota well treated by Pico laser. And these patients with mixed lenticular melasma treated by combination of different types of PicoLO laser, and the efficacy was very satisfactory. And these patients actually worry about melasma. Melasma is very widespread in Asian patients, but difficult to treat. But this patient treated with different types of PicoLO laser, and the efficacy was very satisfactory. These patients actually fail to treat with conventional Q-switch NDX and treat again with PicoLO laser, very recalcitrant melasma was generally well treated with toning fraction of PicoLO laser. So she was very satisfied with the result. So here is my brief opinion for the treatment of benign pigmentation with PicoLO laser. Relatively lower energy application of PicoLO laser is needed in these indications, comparing with traditional use of nano laser regimen. General efficacy of PicoLO laser is slightly better than that of nano lasers with less incidence of PIH. I know that we Asian doctors are very scared about PIH, right? But application of 5-3 irradiation was relatively safer than that of Q-switch NDX. And fractional 532 tip is sometimes useful for these indications. And PicoLO laser can be used satisfactorily for these cases. I like to explain this kind of histologic specimen. With the same irradiation, figure A is that of nano laser and figure B for PicoLO lasers. You see here the important microstructure of D junction is broken up with nanosecond laser, but that kind of important microstructure is relatively preserved for PicoLO laser. And this kind of difference generally guarantees less instance of PIH for PicoLO laser. And here is my opinion for melasma treatment. As all of you may agree, melasma is very, very difficult to treat for Asian dermatologists, while lots of patients suffer from this disease. I think PicoLO laser toning is comparable or slightly better than the first-line nanosecond laser in the melasma treatment. In PicoLO laser, I usually prefer to use black tip for laser toning, actually. So lower energy irradiation of focus tip is also useful for toning in addition to collimate blue tip. Still, dual laser toning of PicoLO laser with Q-switch NDX or long pulse ND may be a good regimen for some patients. So you can combine Q-switch NDX or long pulse laser with this kind of PicoLO laser for treating melasma or other kinds of endogenous pigmentations. And combination with radiofrequency or tranexamic acid, topical hydroquinone may be still needed. And 1064 DOE mode can be sometimes very effective for melasma treatment. It's kind of interesting phenomenon. I'm going to talk about it later. So we arrive at the third subject. This is the main topic of today. By using some physics of length, you can have very interesting phenomena. You can gather some fractional beam using some physics, and very interesting phenomena happens in detail. Using diffractive character of light, an innovative incorporation of a diffractive lens array, we distribute the beam into peaks of high fluence surrounded by a low fluence background, thereby creating a grid of focused, high-intensity micro-injury zones present as intraepidermal and upper dermal vacuole through the process called laser-induced optical breakdown. This kind of finding has already been explained more than 30 years ago in physics. This article from Physics published in 1996. But you see the conclusion here, picopulses have a lower threshold for optical breakdown, and the size of picoplasmas near threshold is smaller than that of nanosecond plasma. Exactly same thing that I just explained, already elucidated 30 years ago in physics. And this kind of relationship can be theoretically derived by a mathematical formula here and can be observed in experimental setting here. By using this kind of interesting LIOB like thing has already been used in other fields of medicine. Ophthalmology has even used femtosecond laser for eyeball surgery. Again, this kind of LIOB is a very interesting phenomenon. One of the most notable things is it generally protects epidermal layer. Because if we do Fraxel for acne scar patients, the incidence of PIH or post-treatment side effect is very high. But this kind of interesting phenomena generally reduce the likelihood of PIH, burn, or scar. And so this kind of DOE method leads to provide a focal increase in fluence while maintaining overall reduction in energy density. And this kind of interesting phenomena has already been applied to the treatment of acne scar. This cornerstone article published in Archives of Dermatology introduced the result of picosecond laser for acne scar treatment. And this kind of application they got clearance from FDA for the treatment of wrinkle and acne scar in most skin types. And a lot of article is following up. This article published last year in JCD concludes PicoLaser can also be used not only atrophic but also for hypertrophic scars. And this article published in this year introduced the result of PicoLaser for acne scar in Chinese patients. Again, we come to acne scar. This is my article published in PJD last year. Even very mild acne inflammation can lead to acne scar. And you everyday experience facial atrophic acne scar, a permanent sequelae of acne vulgaris may be a physically disabling and psychologically devastating disease. So I'm now actually preparing a book chapter. It's going to be published in Springer Publishing Group this year. The subject is up-to-date therapeutic approach for acne scar in Korean dermatology clinic. And I'm actually checking out all kinds of available methods to treat acne scar. And I'm pretty much sure that in the near future, picosecond laser will play one of the major roles. At this time, 2020, Korean dermatologists actually rely on combination of fractional laser and microneedle radiofrequency for the treatment of acne scar. Combination of various non-ablative procedures may be an attractive means to satisfy both clinical outcomes and safety profiles. This is my article published 2 years ago in Acta Dermatovenereology, introduced a combination of fractional laser and needle radiofrequency for the treatment of Korean acne scar patients. This is kind of very satisfactory, but still clinical necessity for better efficacy and shortened downtime is needed for these procedures. At this point, PicoLaser is in. However, direct comparison between PicoLaser versus Fraxel has rarely been performed. Therefore, we started clinical study pursuing future optimal regimen for acne scar and successfully complete the study with publication in the SCI journal. 17-week prospective randomized split-phase protocol that compare clinical and histological aspects between two facial sites either receiving sequential application of PicoLaser or non-ablative fractional laser for acne scarring. So according to the randomly assigned allocation, on half of the face was treated with PicoLaser and the other side with obium glass fractional non-ablative laser. And patients are supposed to receive 4 sessions of laser, and after 4 weeks later they are supposed to visit for follow-up. And skin biopsy was performed for some patients. And this study was already registered in Clinical Trials Government and performed very rigorously. So finally we succeeded in publication in Journal of European Dermatology and Venereology several weeks ago. I served as the first author, and several eminent professors of Korea also joined this research. And Professor Yang from the professor at Johns Hopkins in the United States also served as the second author. So let me explain one by one. We used PicoLO laser in this study, and the fluence range was 130 to 430 depending on patients. And I use actually medium to short handpiece tips for treatment. And minor pearl stacking for severe scars were used. For the Fraxel side, obium glass fractional laser was administered with this kind of energy range over 4 to 8 passes. Now I open our result. You see here acne scar state was measured as ECA score, and of course both sides you see the score of ECA decreased, but significant difference between Pico and Fraxel was observed just after 2 sessions of PIC lasers. And still this kind of difference was maintained until the final observation. So Pico laser can be said the efficacy of Pico is better than that of fractional laser. And this kind of data was further analyzed depending on subtypes. And as you see in this table, Pico has advantage for the treatment of U type and M type, but still ice-pick V type is difficult to treat with Pico laser only, so you still need cross or other kinds of physical treatment even with Pico laser. And this kind of quantitative data was well inconsistent with qualitative data. You see here, investigative global assessment was generally inconsistent with our ECA score. And you see these pictures, of course, both sides acne scar improved, but the degree of improvement was higher for Pico side comparing with fractional side. And one of the interesting is the background skin tone is also brightened with Pico side. Let me explain this kind of thing in the later part of my presentation. And patient subjective assessment is also very important in dermatology. And more patients with Pico side expressed their acne scar, enlarged pore, and skin texture got improved in Pico side comparing with fractional side. So with just Pico laser, patients satisfied with multiple indications. That is kind of an interesting finding. And safety is also very important. We measure very rigorously about each point of safety issues. Excuse me. As you see in this table, patient in Pico side, the instance of side effect was much lower than that of fractional side. However, as you see in this table, transient pinpoint bleeding is inevitable to Pico side. So, but this kind of side effect generally disappear after several minutes or several hours. We don't have too much worry about this one. And all kinds of other side effects, Pico side had advantage comparing with the fractional side. The average duration of downtime was shortened in Pico side comparing with that of fractional side. We also perform skin biopsy, and as you see in these tables, and mucopolysaccharide increased after treatment. And the IHC results explain these kind of things are partly or totally by way of TGF-beta-1 signaling increase. This kind is very interesting because the initial stimuli between two sides is completely different, fractal versus Pico. But the final result is actually identical. That is kind of very interesting, and further basic science needs more study about this issue. So anyway, this is the abstract of our article. So compare with non-ablative fractional side, Pico afforded better clinical outcomes and fewer side effects in the treatment of acne scar in Asian patients. These pictures, patients enrolled in our study, Pico laser also has that kind of advantage comparing with fractional side for the improvement of scar. But as you see here, if patients with severe scar, Pico is not perfect. You still need combination with needle radiofrequency or cross or other kinds of physical treatment. I actually use this PicoLO laser not only for this study, but also in my everyday practice. These patients concerned with acne scar, pore, and skin texture treat with PicoLO laser in combination with needle radiofrequency. The efficacy was very satisfactory. And this patient actually very worried about side effect, but no remarkable side effect was observed at all with this kind of combination. And these patients, actually patients complain more than one indication, right? This patient concerned with skin texture and brightness and treat with different tips, combination of different tips of PicoLO laser, and multiple kinds of indication has been improved with this kind of patients. So you can apply just with one PicoLO laser with different tips. You can expect more improvement for more than one indication. This patient actually concerned with skin texture and brightness altogether and treated with different tips of PicoLO laser. The efficacy was satisfactory. So with textile improvement, further roles of 10-6-foot DOE in pigmentation and melasma treatment with distinct mechanisms are observed. This is another subject of further study. So this kind of interesting finding has been published in academia, and this article published in Blue Journal concludes treatment with Pico laser in patients with Fitzpatrick skin type 4 to 6 result in no permanent complication for acne scar treatment. So let me show you my practice in this animation clip. If patients with acne scar visit my clinic, actually the first treatment is radiofrequency here. Needle radiofrequency for whole around the face, 2 or 3 sessions, right? It's also non-ablative, so you don't have to worry about side effect. And then I go to some cross or subcision or physical treatment at the second step, especially for ice pick scar or deep scar. Then I go to PicoLO laser. The company actually provides 3 different tips. Short tip covers deep dermis, and medium tip upper dermis, and long tip epidermis. So depending on patient's scar state and skin state, you can change the tips. I usually like to treat with combination of different tips, and you see here pinpoint bleeding is actually unavoidable, inevitable for most patients, but this is going to disappear soon, so you don't have to worry about too much about that. So changing different tips, you can cover most kinds of scars. So, and sometimes the patient concerned about skin texture, sometimes I use long tip. So this kind of combination is very effective. And this kind of redness goes soon, so you don't have to worry about side effect. The company provides 3 different tips. Actually, they just provide this kind of crystal models. So, but this is not in vivo data, so I pushed the company, and finally the company worked with Dankook University in Korea, and finally result in animal data. So the biopsy was conducted based on the current parameter, and the guinea pig most similar to human skin was selected. So now I open data first. If I use short tip, you see the green dot here, green star, is the microcavity caused by LIOB, right? And the medium tip have this kind of cavity in epidermis, and long tip in the cavity exists in epidermis. So histologic findings of skin treated with PicoLO laser revealed the formation of cystic cavitation lesion at the epidermis and dermis caused by LIOB. So this kind of finding with PicoLO laser was actually very well consistent with that of previous findings. So the company also tried the 532 fractional tip. I'm not going to deep into this issue today, but they conclude that this technique may enable a breakthrough skin rejuvenation method by introducing a safe treatment procedure without damaging the epidermis and D junction. Exactly same explanation that I just mentioned before. So all data from PicoLO laser from laser optic. So I think this slide is very important. Based on my experience and after conversation with different doctors, I think PicoLO laser acne scar treatment needs dexterity and deep knowledge of lasers and acne scar. So I summarized my conclusion in this slide. So let me explain one by one. First, LIOB reproducibly and reliably observed in human skin with PicoLO laser. The second, superficial intraepidermal LIOB were seen in skin treated at higher energy levels, and deep intradermal LIC were seen in skin treated at lower energy. So you can actually reduce the energy for the target in deep dermis. It's kind of interesting, right? It can be explained plasma shielding effect in physics, but I'm not going to deep into this issue today. But the second statement is very important. The third, dermal LIOB cavity lesions are usually larger than those of epidermal lesions. Fourth, short tip foam attachment partly guarantees deeper penetration of LIOB. 5. Minor pearl stacking with backscattering effects can be helpful for severe scar, as stated in our publication. So you see here, this historic specimen explains deeper LIOB actually creates large microcavity, but epidermal one is relatively smaller. It also explains our guinea pig model. So you think about your target and you think about physics of laser when you treat patients with PicoLaser. So now we arrive at the other session. I think PicoLO laser from LaserTech is actually very well made, and its main advantage is stability. At the year of 2020, the most important virtue of PicoLaser is stability. And at that point, PicoLO laser has advantage. It has strong stability for energy and pulse duration. And intrinsic high power of picosecond laser generally guarantee reproducibility of power supply and pulse duration. LaserTech is actually very famous in Korea for their craftsmanship. This guy, Dr. Chu, he is the founder and CEO of this company. He's very research-minded. He's actually laser physicist. So we always talk about physics when we have a meeting. And Mr. Lee, Mr. CJ, my big brother, CJ, is an expert in laser business in Korea, very famous. So if you have a plan with LaserTech in the near future, I definitely guarantee that you can trust them, actually. So this is my testimonial for LaserTech. So as a key doctor of LaserTech for the past 5 years, I have used lots of laser products made from this company. And LaserTech is actually very famous in Korea for its excellence of laser technology and craftsmanship. So I recommend you experience this kind of very masterpiece level of products of LaserTech in your clinic. So we Korean dermatologists actually have about more than 8 options to select which kind of late picosecond laser, but I think if you consider many other factors altogether, price, design, efficacy, safety, stability kind of something, I think LaserTech PicoLO laser will be one of the best options for you. I have a seminar in IMCAS last year, and a lot of doctors from United States, Europe, East Asia, and South Asia visit my clinic to check out PicoLO laser. We have very good discussion about that. So interest for PicoLO laser from various countries are increasing. So this is the review article published in Derm Surgery last year. And PicoLO laser used for tattoo pigment removal has exhibited notable success, and the use for other entities is expanding. The application have now extended beyond tattoo removal to acne scarring. And our first study for Pico versus Praxel will be another cornerstone for this kind of important and interesting issue. So this is last slide. Pico lasers has brought remarkable change in the treatment of pigmentation and scar for dermatologists. And current Pico lasers demonstrate much improved results for tattoo removal and slightly good results for other pigmentary conditions compared with nanosecond lasers. LIOB process by Pico laser is very effective for dermal remodeling, possibly changing current paradigm of scar treatment in the future. And PicoLO laser by LaserTech demonstrate impressive results with superior safety profile for last 3 years. And our clinical study further demonstrate the efficacy and safety of PicoLO LIOB in the treatment of acne scar. Thank you.
Thank you, Dr. Kwon, for sharing clinical information of LIOB. Several questions have come in during the presentation. Okay, the first one is, with the LIOB, do you do full face treatment or just for a certain area like scars only, or enlarged pores on nose and cheeks?
Actually, because this kind of Pico LIOB has efficacy not only for acne scar but also textural issue, I usually treat whole face with Pico laser.
Okay. And do you use LRB for pigmentation treatment as well?
Yeah, as I explained in my presentation, very interestingly, PicoLIOB has effects for pigmentation. So I usually treat PicoLIOB for acne scar patients, but after finishing the treatment, their background color is actually brightened. It's very interesting and further research is needed.
Okay. The next one is, can you give us more details of treatment technique when you're using fractional handpiece? For example, the distance between the handpiece and the skin, or how much overlapping is ideal, or how many passes, or what is in a good endpoint?
I actually prepared a slide that how we can modulate the PicoLaser when treating patients. I think that kind of slide can be a good answer for you. But as I want to emphasize again that you should know about physics of PicoLaser very well, and you should well know about patient's individual states, and you can combine both of them for best result.
Okay. And pimples are sometimes the issue after fractional PicoLaser treatment, and how do you deal with it? Or is there any tips to prevent this issue?
Actually, this kind of pimple is inevitable not only for PicoLaser but also for other kinds of laser, right? Especially for Asian patients. You can modulate, tune down those kind of energy or fluence. But I think if you prescribe some kind of topical medication, those kind of pimple will come soon. So that will not be the major side effect for PicoLaser.
Okay, if you don't have further questions, I'm gonna wrap up. So if you have any further inquiries or unanswered questions, you can email us via the email address shown on this slide. Just let you know that you will be able to reaccess today's webinar again on our website after 1 or 2 weeks. Next Laser Uptake webinar is scheduled for August 8, and it will be about PicoLO treatment for Asian patients. I hope you're interested in and register. A big thank you to our special guest speaker, Dr. Kwon, for your great presentation, and also thank you to the audience for joining us tonight.
Thank you very much.